Hi, I'm Dr. Eli Whitney with the Heart and Vascular Institute of Texas. I'm here to talk about Niaspan. Niaspan is the newest form of niacin therapy to help restore cholesterol balance in the blood. Of course, niacin is a common B vitamin found in fruits and vegetables. Niacin has been used for more than 50 years in medical practice, making it the oldest medication to lower cholesterol levels. There's good reason for this. Niacin has multiple effects on blood cholesterol levels. The major effects are to lower the VLDL cholesterol, that is, the triglycerides. It also helps lower the other bad cholesterol called LDL, and niacin helps increase HDL cholesterol, which is the good cholesterol. The dynamics of how niacin works remains a mystery, but it clearly increases the number of HDL particles made by the liver and thus promotes the removal of cholesterol from the walls of blocked arteries. There are several advantages of niacin. The first is that niacin is relatively inexpensive. Another advantage is that we know virtually all of its side effects since it's been used for so long. A third advantage with niacin is that it's been proven to not only lower the risk of having a heart attack, but has also been shown to increase the length of life in patients when followed for more than 15 years. The most important study that demonstrated niacin at work was the Coronary Drug Project. Researchers took more than 1,000 men who had recent heart attacks and placed them on niacin. Then they compared the heart attack and death rate in these men to over 2,500 men who received a placebo, that is, a pill that looks like a medication but is not. Niacin reduced cholesterol about 25 points. After 7 years of therapy, niacin reduced the risk of heart attack and death by 21%. When patients were followed for 15 years, there was an 11% reduction in all causes of death, not just heart attacks. Niacin has been shown in 3 other studies to reduce the risk of heart attack when used in combination with other cholesterol-lowering medications. There are, however, several disadvantages to niacin. The first is that niacin can increase blood sugar levels, particularly in some patients with diabetes. For this reason, patients with diabetes should be treated with low doses of niacin initially and followed carefully. The second problem with niacin is that it can increase the likelihood that a person will develop an ulcer. This primarily is a problem in patients who have known ulcers. Niacin can be used in ulcer patients, but they must be on ulcer prevention medications. A third disadvantage of niacin is that it can cause gout, a painful arthritic condition usually involving the big toe, ankle, or knee. Niacin can be used safely in patients who have gout if they are being treated with medications such as allopurinol or Benamid. Another disadvantage with niacin is that in some patients it can increase the wear and tear on the liver. Every day a certain number of liver cells die and are replaced by new and healthy liver cells. The death of a small number of these liver cells every day is completely normal. When liver cells die, they release their protein contents called ALT into the blood. Hence, when we measure the amount of ALT in the blood, we get an indirect assessment of the number of liver cells that have died in the previous day. Small increases in the ALT, or liver wear and tear, are of no concern since the liver regenerates itself so easily. It's only when the wear and tear increases a lot for many years do significant problems develop. But the liver is a very tough organ. It can stand a lot of wear and tear. If excess liver wear and tear is caused by niacin, just stopping the niacin or reducing the dose will correct the problem and avoid permanent liver problems. The increase in liver wear and tear occurs in 1% or less of patients who are taking less than 2,000 milligrams of niacin per day. The major side effect of niacin is on the skin. Plain niacin produces a flushing sensation about 20 to 25 minutes after it's taken, and the sensation usually lasts 30 minutes to an hour. This flushing sensation is usually felt as a hot, burning, or prickly sensation in the hair, face, neck, arms, and even the abdomen and legs. This flushing sensation is very frequently associated with reddening of the skin, with a blotchy appearance, and occasionally as hives. This flushing sensation is not harmful, but it is very irritating and itching to certain individuals. Furthermore, if a person does not know what is causing this sensation, the flushing can be quite scary. Unfortunately, the skin burning sensation causes about half of patients who take plain niacin to stop it within a year. There are several ways that this flushing sensation can be reduced. The first is to take an aspirin every other day. This produces a large decrease in the burning sensation. The second way to reduce the flushing from niacin is to start at a very low dosage and gradually build up to higher levels. If a patient is on a certain dose of niacin and experiences flushing, when the dose is continued for several days or weeks, the flushing sensation will go away. At this point, the niacin can be increased to a higher dose and the process repeated. Niaspan is a new, high-quality, slow-release form of niacin which has minimal side effects, excellent safety and effectiveness. Niaspan only causes mild flushing in 1 to 2% of patients, and it is distinctly better than plain niacin. Although Niaspan is a niacin product, it's the way it's delivered into the body that makes the difference. Niaspan is an innovative hydrogel programmed release formulation. This means Niaspan only has to be taken once a night before bedtime to receive the full benefits with minimal side effects. Regular niacin has to be taken several times a day. A typical schedule for starting Niaspan is 375 milligrams per day before bedtime for 1 week, then 500 milligrams before bedtime the second week. On the third week, 750 milligrams per day before bedtime. On the fourth week, start 2 500 milligram pills or 1,000 milligrams at bedtime. After 2 months of being on 1,000 milligrams of Niaspan per day, the blood should be checked for cholesterol levels, the liver ALT test, and fasting blood glucose or sugar levels. If necessary, the dosage of Niaspan can be advanced further, but at no time should Niaspan doses exceed 2,000 milligrams per day. I would like to reiterate, the increase in wear and tear with niacin on the liver is generally minor and of no consequence if a person is being followed medically by a physician. Virtually all of the serious problems with niacin occurred when patients were taking high doses of niacin without being supervised by a medical doctor. In summary, niacin is a valuable cholesterol-lowering medication which increases HDL, the good cholesterol, and lowers the bad LDL and VLDL cholesterol. The major disadvantage with plain niacin is that it causes people to flush and burn shortly after taking it. Niaspan, the new, high-quality, slow-release form of niacin, rarely causes burning and itching and is safe and effective as plain niacin when the amount is 2,000 milligrams per day or less. One of the most important uses of Niaspan in the regulation of cholesterol is that it can also be used safely and effectively with the statin medications to further lower cholesterol levels and improve HDL cholesterol. The final question is, how long should I take the medication? That is, do I really need to take these medications all my life? These cholesterol-lowering medications will not change a person's metabolism permanently. If you take these medications properly and with proper supervision, you will see an improvement in your cholesterol numbers and a reduction in your risk of having a heart attack. Furthermore, you will probably increase your lifespan. Once the medications are stopped, however, cholesterol levels will soon return to their previous levels and the benefit of the medications will be lost. So when asked the question, do you need to take these medications for the rest of your life? My answer is very simple. You do not need to take these medicines for the rest of your life. You need to take them until you are 95 years old. Once you are 95 years old, you have my permission to stop all of your medications and have a party. This is Dr. Eli Whitney with the Heart and Vascular Institute of Texas.